Welcome to the Real News Network. I'm Sharmini Pires coming to you from Baltimore. It is no mystery that burning fossil fuels releases carbon dioxide into the atmosphere. Along with it also comes co-pollutants like ozone and particle matter that are hazardous to human health. A recent analysis of the data from an EPA study says that 48,000 premature deaths can be attributed to fossil fuel burning, and the estimate is actually considered conservative by its very authors. A 2013 study done by MIT with slightly different assumptions puts the estimate as high as 200,000 early deaths. A new research brief titled Air Pollution Co-Benefits Associated with Healthy Climate and Family Security Act of 2014 has taken a closer look at the bill that was introduced by Representative Chris Van Hollen in July of 2014. It looks at the impact the bill could have on our health while reducing CO2 emissions. Now joining us to discuss the study is one of its co-authors, Professor James K. Boyce. He is the director of the Program on Development, Peace Building, and the Environment at PERI, UMass. James, thank you so much for joining us.
Thank you for having me, Sharmini.
So, James, what is the act proposing to do? Let's just begin with that.
Well, Congressman Van Hollen's bill would put a cap on the total amount of fossil fuels that are burned in the United States. It would limit the entry of coal, oil, and natural gas and the carbon embodied in them into our economy. And it would issue permits up to the cap, up to the level set by the cap. That level would diminish year by year down to 20% of the current level by the year 2050. And the permits would be auctioned off, not given away to the polluters. And the money from those auctions would be returned to the American people on an equal per person basis. The cost of those permits would become part of the price of fossil fuels. So in the end, consumers would have to pay higher prices, and those who consume more fossil fuels would pay more than those who consume less. But everybody would get back the same amount of money. The money would be recycled to the public. The effect of that would be that the majority of the people would actually receive more back in dividends than they're paying in higher prices. So they would benefit in pocketbook terms. And then on top of that, because as you mentioned, reducing carbon emissions would also reduce emissions of lots of other types of pollution, there would be tremendous public health benefits as well.
And in your particular study, what did you try to find out, and what are your main findings?
Well, what we did was fairly simple. We looked at the level of mortality and illness burdens, and the monetary costs of those effects currently, from the combustion of fossil fuels. And we based those estimates on a study done by scientists at the U.S. Environmental Protection Agency, as you mentioned. These estimates, if anything, might err on the conservative side in that they don't take account of the full range of co-pollutants emitted when we burn fossil fuels, nor do they take account of the fact that the particulate matter generated in fossil fuel combustion may actually be more hazardous than ordinary particulate matter. But using those estimates, we then said, well, if we reduce our use of fossil fuels on the schedule that the Healthy Climate and Family Security Act, Van Hollen's bill, will require, how much reduction in pollution would we get? And if health impacts, mortality, disease impacts, monetary impacts, all diminish proportionally with our use of fossil fuels, how big would those be over the period between now and the year 2050? So that was what we estimated in our study.
And your findings?
Well, we found that in the case of mortality benefits, there would be about 700,000 lives saved over that 35-year period. The number of lives saved would increase over time as the cap got tighter and the use of fossil fuels diminished accordingly. But on average, we'd be seeing about 20,000 premature deaths averted every year during the lifespan of the bill. So that alone is a really substantial benefit. That's a lot of lives. On top of that, there would be averted healthcare costs, averted cases of asthma, exasperation, respiratory disease. There would be fewer days lost from work as people get sick as a result of these air pollution-related illnesses, either themselves or have to stay home to take care of a sick child. There would be fewer days lost from school. So we estimated some of those effects as well. We estimated that over the 35-year period between now and 2050, implementation of this bill would avert about 90 million lost work days and a similar amount, roughly 90 million lost school days. Would also avert about 43 million cases of asthma exacerbation. So we're talking about really substantial benefits in terms of public health. And it's really important to lift these up in our discussions of climate policy, because all too often the policy issue is posed as a trade-off between the welfare of the present generation and protecting the climate for future generations. The fact of the matter is, Sharmini, that implementing a policy that drives forward the clean energy transition can bring tremendous benefits in terms of public health to the present generation as well. And if, moreover, we recycle the money from higher fuel prices resulting from a cap or equivalently a carbon tax, if we recycle that money back to the public, most people can come out better off in pocketbook terms as well. So there are really two major sorts of benefits to the present generation from implementing a climate policy: a public health benefit from cleaner air and a financial benefit from divvying up the carbon rent in an egalitarian fashion. And those benefits come on top of course, the fundamental purpose of the legislation, which is to try to reduce global climate change so as to ensure a habitable planet for generations to come.
And James, you've been studying this issue for a while, and when you look around the world, is this the best option we have in terms of a solution to this particular issue?
Well, I think the same advantages that implementation of this bill would have in the United States in terms of both cleaner air and public health, and in terms of recycling the money from higher fuel prices into the pockets of working families, those same benefits would accrue to any country adopting such a policy. And in fact, in countries where there are worse air pollution problems, where the levels of co-pollutant emissions from fossil fuel combustion are even higher than those in the United States because some of the environmental regulations are weaker, in those countries the co-benefits would be even larger, the public health benefits even more substantial. In fact, I have the impression that one of the reasons why China, for example, has been moving forward in implementing policies to try to reduce its use of fossil fuels, for example, by putting a cap on carbon emissions in the greater Beijing area, is precisely because of the public health benefits of the policy. They're worried about the toll that air pollution is taking on the health of the current generation and on the health of children. And they're trying to do something about that. And the best way to do something about it is to get the economy off the dependence of fossil fuel, which basically means digging up poisonous stuff from under the surface of the earth that's been buried there for hundreds of millions of years and burning it in order to get energy. I think in the future, people will look back on that as a pretty primitive way to meet our energy needs. And one of the costs of that is the tremendous toll that air pollution is taking on public health around the world, but especially actually in cities like Beijing or New Delhi, where the co-pollutant burdens are truly staggering.
James Boyce, I thank you so much for joining us on the Real News Network and for doing this remarkable study. Thank you.
Thanks for having me, Sharmini.
And thank you for joining us on the Real News Network.